This section is on identifying abnormalities, and this is different than the normal anatomy of a radiograph. This is more of detecting diseases on the radiograph or just things that aren't a part of your normal anatomy. The first thing we have is periodontal disease. So, periodontal disease we know is inflammation of the gums, or more advanced gum disease. It can create bone loss, or that's part of the way we diagnose it. And it can be viewed a couple different ways or at a couple different levels on a radiograph. And the first thing I want to point out is this tooth right here. That is what your normal periodontal attachment or periodontal apparatus should look like. Next, we move on to what they call incipient periodontitis, or the beginning stages of periodontal disease. And that is this one right here. You can see that in this area, the level is starting to decrease. That's what that dark gray area is, that level of bone that is starting to go down. And then we have early periodontitis. And that is this one right here. You can see that bone level has just continued to go down until we have moderately advanced periodontitis and advanced periodontitis. And so bone loss is one of the obvious indicators of periodontal disease, but something else that you can look for is blurring or discontinuity of the lamina dura, or the bone surrounding the periodontal ligament. So here, this white area, that's our lamina dura. You can see there's nice continuity here. But as we follow along and we get up into our incipient periodontitis, you can see that lamina dura has started to fade out a little bit. And as we go down, follow along, it's continued. As we go down and follow along, it's continuous until we reach this area right here. You can see there's a clear break in that lamina dura. That's what tells us this is periodontal disease, or one of the indicators that this is periodontal disease. Right here, again, that lamina dura is broken, and here, that lamina dura is completely broken, almost to the point where you could say it's about to be non-existent. While the periodontal ligaments are normal anatomy, any break in that structure, any irregularity in that structure is an indicator of periodontal disease. Next, we have a periapical abscess. Your patient may arrive at the office with a tooth that is sensitive to the touch or sensitive to pressure, and they might talk about having an ache in the tooth. This is a pretty good indicator that we already know what's going to happen on that x-ray. We're going to find an abscess. And an abscess is a localized collection of pus in the periapical region of a tooth. And on this x-ray, you can see it says abscess right here. And then what it is talking about is, see how this tooth, this root, has a shadow around it? That shadow, that dark area, that is the abscess. That is telling us that there is an infection in this area. And I defined it as a localized collection of pus. And what's happening there is that pus-filled pocket is your body's response to the infection, and it's forming a barrier around that infection so that it doesn't spread to other teeth, or it hopefully will not spread to other teeth. It's likely at this point that the dentist will prescribe an antibiotic, but then they may need further treatment such as a root canal. It could need drained because of the infection, or it could need extracted depending on what else is going on with the status of the tooth and the surrounding tissues. This next abnormality is an apical cyst. Sometimes it can be referred to as a radicular cyst as well, and it's usually going to appear on the radiograph as a round or pear-shaped lesion. And Here is one. I feel like these ones on this particular x-ray are pretty obvious. This dark area here and this dark area here. Initially, your patient may not have any symptoms with this cyst. It's something that's going to develop over a prolonged period of time, but eventually it could cause swelling and pain. It is usually caused by an infection in the root that's caused by decay or untreated dental caries, and then bacteria reaches the pulp. Again, your body tries to fight it off, and simply put, toxins form around the apex of that tooth, and then that's what the cyst is created from. And these can be fixed through either an extraction or a surgery around the periapical area. After this, if the tooth is to be saved, it most likely will need root canal treatment. This next one is an apical lesion or a granuloma, and it is chronic inflammation located at the apex of a non-vital tooth. In this case here, the pulp is no longer vital and it could be asymptomatic, but this tooth usually will have had a history of prolonged sensitivity to heat or cold. On the radiograph, it can usually be seen as a widening periodontal ligament space towards the apex. So if you look, here's that periodontal ligament space, and it starts to get wider right in this area. And then same thing over on this side. And then you can see this dark area that goes around here. Same thing over on this one. If you follow down that periodontal ligament space, right about here, it starts to widen out this whole big area. And then same thing over here. This side, it's not quite as wide. But then over on this side, you can see this whole area right here should have that periodontal. That whole area right there should have that periodontal ligament up close to it, but it's wide. It's that widened space that indicates a granuloma. Treatment for this may be an extraction or a curettage around the apical region. This image is condensing osteitis. This image is apical condensing osteitis. This is a radiopacity found below the apex. So in the same general areas that we've been seeing our previous abnormalities, but this one is a radiopacity. So this area I'm tracing here. And it is seen below the apex of a non-vital tooth that has had a long history of pulpitis. These can be different sizes, they can be different shapes, and they're not going to look like they're attached to the root of the tooth, where some of the other ones may kind of look like they are attached or surrounding that tooth root. The most frequently involved tooth is the mandibular first molar, and this tooth is usually going to have a large cavity or a large restoration. It will be recommended at this point that the patient sees an endodontist. The endodontist will determine the status of the tooth and may then be referred out for an extraction or seek endodontic treatment. Hyperdontia is a condition that causes too many teeth to grow in your mouth. As you can see, this mouth is full of teeth, and they will grow anywhere that there is a curved area where teeth are able to attach to the jaw. Some cases of hyperdontia don't need to have these teeth removed if they're not causing any issues, but there are other cases where it is quite extreme and these teeth will need to be surgically removed. Some of the reasons why they may be removed is if it's causing the patient to not chew properly, or if they feel any type of pain or discomfort. If these extra teeth are creating a difficult time for the patient when it comes to brushing and flossing. Or in some cases, the patient may just be a little bit self-conscious about the way they look and request they be removed. This next one is called dens in dente, or when you kind of literally translate it, it means a tooth within a tooth. And what happens here is that the enamel folds into the dentin during the tooth development. And so with this picture, you can see they've already circled here in red what the area is we're focusing on. But if you look very closely, you can see the inner layer of enamel on the additional tooth that is in that mouth. And then the darkened area right in here is the dentin. So it's literally a tooth within a tooth. Treatment for this will vary based on the severity of it. Basically, in a minor case, you might be able to just seal that opening, which in the real tooth you can see is kind of this little area right here. They may seal that with some composite or even a sealant. That way there's a nice little barrier over top of it and you can't have plaque settle in that area, and it will decrease the chances of forming decay. In more serious cases where it may have affected the pulp, the dentist may recommend that this patient have root canal treatment. And it's basically handled just like a regular root canal treatment or root canal therapy, where gutta percha may be placed inside and then the crevice again is sealed off. An enamel pearl is a condition of teeth where the enamel is going to be found in different locations that enamel wouldn't normally be found. So, in this example, it's on the root surface, as many of them are found on the root surface, and it's usually going to be found near a furcation. And this can actually affect the overall health of this tooth, and it can contribute to gum disease. Sometimes they can be mistaken for calculus, and if left untreated, it can cause inflammation and bone tissue destruction. And as we all know, that can jeopardize the health of the overall tooth. It can lead to periodontal pockets. It can just create overall health problems for the status of this tooth. Once it gets to that point, an extraction may be the only option. For this slide, we have two conditions, and the first one is called tarodontism, and that is going to be the first slide here. And this is a condition that affects mostly the molar teeth, and it's where what they're calling the body of the tooth and the pulp chamber is enlarged. And it's going to be enlarged vertically, which means that the roots may suffer some. So here we have right here, this is an enlarged pulp chamber, and these roots seem to be smaller than an average root. It is a condition that has no symptoms. It can only be diagnosed with an x-ray, and it is likely that it will not require treatment. However, it can however, it can create problems down the road for a patient if they need to have other procedures done. For example, a root canal. Because of the shape of the tooth and the shortened roots, it makes it a little bit more difficult for anyone to be able to fill the canals properly. To help give you a visual of this, picture yourself with an extremely long torso and very tiny legs. It would be almost impossible to find clothes that fit you. So it's kind of a similar situation here. Just it makes it more difficult to treat the tooth for other things that may be wrong with it down the road. But the condition itself does not require treatment and does not have any symptoms. And next is the supernumerary root. They're sometimes difficult to see on an x-ray, but for this one, we have one here. There's another one that's sticking out down here, and there's one here, and then I believe this is the end of the other one here. And basically what a supernumerary root is it's just an extra root on the tooth. The most common teeth affected by this are your mandibular lower canines, premolars, the molars, and especially the third molars. To help you get a visual or a better visual here of the supernumerary root, we have this image here. So we've got a tooth that has been endodontically treated and has that extra root. The next thing we have is a condition called amelogenesis imperfecta. This is something that happens during tooth development, and as a result, the teeth are going to end up looking smaller than normal. They may be discolored, they're going to have different grooves on them, and they are going to wear more quickly and break more quickly than a properly developed tooth. And you can see on the x-ray here some of these darker areas. That is going to be what it looks like on the x-ray. So this is amelogenesis imperfecta. And the treatment for this is going to depend on the severity and the type of the condition. But some different options are bonding, full crown restoration. They may go through orthodontic treatment. They may be coached on oral hygiene extensively. They may be encouraged to have a low sugar diet. And eventually it could be that they will need dentures. This condition is dentinogenesis imperfecta. This is a disruption in dentin formation, and it will cause the teeth to appear to have a bluish gray tint to it. But on the radiograph, the teeth will still appear radiopaque, but the tooth will have the same radiopacity as dentin. Basically, the entire tooth. You will see the difference between the enamel structure, and you will see the difference between the dentin. So here is this dentino-enamel junction. But there is no or a small pulp chamber, and there are very small or no root canals present. So you can see down here through the root of the tooth, there is no pulpal. You can see down here through the tooth, there is no radicular pulp, or there is no pulp in the roots. Treatment is going to vary depending on the patient's age. But things that can be used would be amalgam fillings, veneers to fix the discoloration, crowns will also do the same thing. Dentures or dental implants may be something that's needed in the future if teeth are lost. And some dentists may recommend bleaching and then composite resin restorations once they've reached the desired shade. And denti then we have dentigerous cysts. This is another slow forming condition, and it is going to be non-inflammatory. And on a radiograph, you will see it around the crown of an unerupted or an impacted tooth. And it's going to be this area here that is surrounding this tooth. And you can see it has that dark shading to it. Treatment for this will be to try and remove the cyst. And then most likely they will remove the unerupted tooth. If it looks like the tooth can erupt okay, they may leave it in place and allow that tooth to erupt naturally. This is a fractured tooth. This is one of the ones that can actually be more difficult to diagnose. Sometimes that fracture is so small that it can't be seen on an x-ray, but here we have this fracture here, and then it looks like this fracture here. So those are pretty easily recognizable. Symptoms of this is going to be pain that comes and goes when you're eating or when you're chewing on certain foods. And treatment can be a couple of different things. A lot of people will opt to have it extracted because it's just, in their perception, it is simpler. But it can also just be observed to see what happens and how the pain may develop if it does develop into something else. Or it can be crowned. If it's severe enough, they may need to have a root canal completed before the crown. But as I said, a lot of people will just opt straight for the extraction. This is a salivary stone, and this is a calcified structure that forms inside of the salivary gland, and it most of the time will block the flow of saliva into the mouth. They may cause no symptoms as they are forming, but if they get to a large enough size where they're blocking the duct, the saliva will back up into the gland and you will see pain and swelling. Patient may feel the pain off and on, and it may get progressively worse. Sometimes these buttons are so finicky. If continued to be left untreated, it could lead to an inflammation. If continued to be left untreated, it can lead to inflammation and eventually an infection. And on this image here, this is your salivary stone. A lot of times it's made of calcium. It's just an overabundance of chemicals in the mouth that block up that duct and create that stone. For treatment of the stone, the goal is to get rid of it. So they may do a couple different things. One thing is that they could encourage the patient to suck on lemon or sour candies. This can cause the stone to kind of dissolve and pass on its own. In other cases, the doctor may be able to massage the stone and push the stone out of the duct. So these are the least invasive procedures. If the stone is larger, the doctor may have to make a small incision in the mouth to remove the stone.